Hello everyone, welcome back to a new video. So today we'll be talking about an important topic, that is the GCS or the Glasgow Coma scale. So what is the Glasgow Coma scale? It is a system to score or measure how conscious you are. It does that by giving numbered scores for how awake you are, your level of awareness and how you respond to basic instruction. So basically what is GCS? GCS nothing but an assessment. It is an assessment to measure our level of consciousness, to measure the level of consciousness. So basically we are, by performing this test, we are often examining our brain, mainly the central nervous system, about how awake we are. So what are the criteria or what are the factors that is depending upon this test? We are performing the test by the eye movement, motor movement, the verbal response, and also the pupil movement, which is popularly followed in the GCSP, where P stands for pupil, about the contraction and dilation of the pupil. So in normal GCS, the pupil movement though is significant, but however in GCSP assessment it is even more significance. So scoring, as I have just mentioned, that there are certain scores are given upon the basis of the response. So how do we give the scores? For example, if we talk about the first criteria, that is the eye response, we are giving a scoring from 4, 3, 2, 1. So when to give what scoring? Let's study. Firstly, we'll give the score 4 whenever the patient reacts or performs the eye movement spontaneously. For example, if you just tell the patient that hey or how are you or like any kind of question, and the patient suddenly looks to you or gives any kind of movement, then you will give the score as 4. Next, to speech, means you need to ask the patient about something. You are just stating something, and then the patient responds by his eye or any kind of eye movement, then you will give 3. That is a 3 points. Next, to pain, that means the patient can't hear anything. Here you need to apply pain stimulus for the patient to understand or to perform the eye movement. In that case, you will give 2 marks, and 1 marks will be given when there is absolutely no movement of eye at all in the patient despite being any stimuli. So this was the scoring for the eye responses. Next, the verbal response. So again, it consists of the 1, 2, 3, 4 and 5 scoring. So when the patient is oriented to time, person and place, means whenever you are asking the patient about the time, the person, place or any personal information, and if the patient is able to answer all those things, then you will be giving 5 points. And confused, means the patient is not aware of the fact, that is not what fact, about time, person, place, or who is, where he is, how did he came, he does not remember anything, then he will be giving 4 point. And third point will be given where he said inappropriate words, means rather instead of stating his or narrating his incident, he is telling random thing, for example chair, table, book, or any other inappropriate at that situation. So it is, in that case you will be giving 3 points. And next, you will give 2 points when he will make incomprehensible sound, means for example just ooh, like that kind of sound, those does not make any sense. So 2 points for that, and 1 point is for those who cannot respond to anything, no verbal response at all. Another criteria is the motor response. So it is a very important one. It consists of the 6 criteria. Firstly, when the patient obeys to any, follows any kind, is able to follow any command. For example, if you ask the patient to drink a glass of water or to hold a glass, or any other command, and the patient is able to do that, then you will be giving 6 points, means he is fully okay. Then moves to localized, means you are asking the patient to show where the pain is, or he is not able to perform the action due to the localized pain, he is able to show it, then you give him 5 points. Next, flex, to withdraw from the pain, means for example if we consider this as a hand, and what happened is that if we are just pulling the hand, and what he is doing, that he is flexing the hand towards him, in that case you can give 4 points to the patient. Next, there is abnormal flexion, means you are asking the patient to perform the flexion, but he's not able to do that properly, so you will give 3 points. And when there is abnormal extension, that means you're not able to extend the hand properly, and you will be giving 2 points. And when there is no movement at all, you'll be giving him 1 point, that is no response at all. So based upon the scoring, it comes out that if the scoring is between 13 to 15, then it is mild, which is often considered as good or normal, or almost normal condition. Moderate is kind of good. It just means there, although there are some problems, but definitely the prognosis is kind of good. But severe is condition where the patient often quite goes into the deep coma. This is quite serious. That is why severe. So this was very much for today's video. If you have any doubt regarding this video, do let me know down in the comment section below. Thank you.